Welcome to the CLE course presented by Tom Taormina. Please make notes during the presentation. We'll conduct a Q&A session at the end. You'll also have an opportunity to pose questions about real or hypothetical issues that can directly help you. This courseware contains a PDF file of this presentation for your convenience and for future desk reference. This table of contents is also contained in the PDF file. Please use it as a quick reference for the content. This is Tom Taormina. I was one of the first quality control engineers at NASA's Mission Control Center in Houston during projects Gemini, Apollo, and Skylab. The photo was taken in a staff support room at Mission Control around 1975. For 10 years, my specialty was devising robust supply chain management systems for those providing equipment to mission control. Between that experience and 30-plus years in consulting, I've worked with more than 700 companies. My experiential background is unmatched in this field. In the early 2000s, I was recruited into becoming an expert witness in personal injury, products liability, and organizational negligence tort, and have provided expert testimony in more than 40 cases. Present day, I'm still active in the world of quality and expert testimony. I spent my career coalescing my work as a quality professional and as an expert witness into tools for risk avoidance, business excellence, and litigation. Let's establish some ground rules. I am not an attorney. I'm an expert witness. The following presentation is based on the training and experiences of the author. It's offered as plausible strategies and tactics for licensed attorneys who practice tort law. The author's expertise is in product liability and organizational negligence litigation. Intellectual property divulged in this presentation is principal registered trademark and may not be used without express prior approval. The author is not liable in any way for how this material is used and implemented. Terminology used by the author is not intended to be strict legal definitions. By the mid-2010s, the investigative methodology that I had developed by amalgamating quality management practices with expert witness investigative tools was first published as a proprietary investigative technique that I labeled Forensic Business Pathology, or FBP. For more than a decade, this methodology has been reluctantly accepted by opposing counsel as a valid credential and investigative technique. In 2017, Dr. Vito Brabuscus, otherwise known as Dr. Fire, received certificate number 2, and C&O expert in electrical fires, Judd Clayton, received number 3. In 2022, it obtained Principal Register Service Mark. This is the covert weapon that you will be exposed to in this CLA course. Current day FPP training and certification is being developed as courseware for quality professionals. Certification will be by an international credentialing organization. The genesis of FPP began one fine day when a local attorney called me. He was representing the defendant in a lawsuit. The attorney asked if I would look at the case from a, quote, quality control perspective. Later that week, a delivery truck arrived with half a dozen banker's boxes full of documents. The defendant company was a small supplier of silicon metal. They manufactured metallurgical and chemical-grade silicon and its alloys used mainly by the cosmetics industry. The plaintiff was a large multinational aerospace company that manufactures titanium parts for aircraft such as jet turbine blades and rotors for helicopters. They had purchased silicon metal from the defendant from 1989 to 1997. During that time, there were 13 purchase orders found for 500 pounds of silicon metal each. The batch that led to the lawsuit was for 5,000 pounds. In the time frame that led to this action, the plaintiff was certified to ISO 9001-1994. The defendant was certified to ISO 9002-1994. ISO 9002 was part of the original subset of the international standard ISO 9000 and was primarily used by companies that did not do fundamental design. The litigation occurred in 2003 and 2004. The existing discovery that I was provided included the various legal findings that went back and forth, specifications, purchase orders, and test reports. When retained, I immediately requested the quality manual and any operational procedures on supplier approval, incoming inspection procedures, and the defendant's supplier history. Only a minuscule amount of silicon metal is needed to forge titanium. The defendant kept the product in open bins, not uncommon for their industry. For the batch that was purchased that led to the litigation, apparently a light bulb had blown overhead, and the glass and tungsten filament fell into the bin. Tungsten is one of the toughest elements found in nature. It's super dense and almost impossible to melt. It has the highest melting point and highest tensile strength of any periodic element. The plaintiff alleged that the supplier shipped the lot in question without testing it for contamination. As I was sorting through the data, it occurred to me that I was doing a quality management system audit without having to visit the company. As a consultant, trainer, and auditor to ISO 9001, this was how I always approached failure analysis. There was more than enough documentation to construct the chain of events of how pieces of tungsten were forged into the turbine blades and helicopter rotors, and how it wasn't discovered until the customers received the final product. In my report, I drafted a timeline of how each batch was received, a copy of the receiving report, and a copy of their certificates of conformance. The purchase order stated that the certificate indicate the purity of the silicon metal and the percentages of iron, calcium in the report, nothing else. Especially, there was no requirement to test for contaminants. The certificates were all initialed and dated, indicating that the received batches were acceptable to the plaintiff. The next step was to review the supplier approval process and find supporting data for approval and subsequent reapproval of the defendant. In the documentation, I found a one-page questionnaire dated October 1991 that first put the defendant on the conditional approved supplier list. Creating and maintaining a list of approved suppliers is a requirement of International Standard ISO 9001 and 9002. Every few years, I found letters to the defendant notifying it of the plaintiff's intent to conduct an on-site quality audit. Every time, the letter was answered by the defendant stating that they did not do enough business with the plaintiff to warrant hosting a facility audit. Somehow, these letters from the defendant declining on-site inspections kept the supplier on the plaintiff's approved list for more than 10 years. Clearly, the plaintiff was going through the motions of maintaining approval of the defendant without reading the contents of their responses. In the last attempt, the defendant responded by refusing to sell silicon metal to the plaintiff. The final step in what would become my first forensic business pathology investigation revealed that the plaintiff never tested the raw material received from the defendant. Thus, the batch of contaminated material made it through the entire fabrication, inspection, and test processes with the shards of tungsten forged into the parts going undetected. Since tungsten has a much higher melting point than is used in titanium forging, these shards would have eventually caused fractures that would break the turbine and rotor blades. Fortunately, the plaintiff's customers did inspect them and found the defects before the parts were installed. My investigation revealed that the plaintiff mechanically released the defendant's materials into production with only the data in the defendant's certificate form. The plaintiff never explained why they did not do fluoroscopic testing at incoming inspection, as was their standard operating procedure. In defendant's testimony, it was revealed that its silicon metal was mostly used for cosmetics and was never meant to be used in aerospace. This fact eluded the plaintiff for years. My report, deposition, and testimony in court was a storyboard of how the plaintiff had systematically ignored its procedures for supplier approval, incoming testing, and final testing. In a bench trial, the judge found the defendant not guilty. After my courtroom testimony and verdict, I came to the realization that I had utilized my skills as a quality systems auditor for investigating the issues of the case and then used commonly accepted root cause analysis techniques to reach my conclusions and opinions. What makes this training immediately applicable to tort law and to your future success is creating an awareness that there are proven techniques available to bring about more rapid and more cost-effective resolutions to your cases. The techniques revealed herein are not known to many litigators and will become your secret weapon that blindsides opposing counsel. It's not often in civil and criminal cases that irrefutable evidence is produced by either side. In products liability and organizational negligence cases, however, it's almost a slam dunk when you can document empirically that the company did not follow its own procedures. So, the first task for me was to transform internal quality audits into compelling forensic investigations. In quality parlance, every operation within a company is a process. Every process has an input and an output. What transpires in between the two determines the difference between conforming and defective products and services. Every process is interrelated with the processes that came before and after, creating a cohesive system that can work flawlessly when executed well. Expertly evaluating the effectiveness of business processes is key to conducting FBP investigations. Every process within a business can contribute to its product liability and organizational negligence. In retail, processes are everything from qualifying suppliers, evaluating the quality and reliability of products, and determining whether they are introducing a potential liability into the stream of commerce. In manufacturing companies, processes include design, supply chain management, manufacturing, testing, distribution, and customer service. Each of these processes must be defect-free, or the organization is open to foreseeable risk and potential liability. These two terms are foreign to most manufacturing companies. For service companies, processes may be more difficult to control, especially when supplying service directly to clients. In all cases, process variability leads to defects which lead to potential liability. We've touched on this a number of times, but the process model we just described is the foundation of the international quality standard ISO 9001. The ISO 9001 standard is accepted formally in more than 190 countries. In 2020, there were more than 900,000 certificates issued worldwide. It's unquestionably a robust foundation for establishing duty of care. In the silicon metals case, both plaintiff and defendant were certified by a third-party audit firm to the ISO 9000 revisions that were in place at the time. In adjudicating the case, the standard became prima facie evidence of duty of care. From there, determining appropriate or negligent standard of care is a matter of comparing what is required by the standard and what the organization has documented as to how they will comply with the standard compared to the evidence in the case. History has proven that most companies involved in products liability and organizational negligence litigation failed to follow their own procedures and, by definition, failed to follow the terms of their certification. Citing ISO 9001 as an irrefutable duty of care has never been successfully challenged in any of my cases. If neither plaintiff nor defendant are certified to the standard, it's still globally recognized as a baseline for responsible manufacturing companies. If a company has no formal quality program, I argue that they are negligent in having no foundation from which to demonstrate process compliance. To date, the covert weapon of forensic business pathology has been proven formidable in establishing duty of care, regardless if they have any type of formal quality program. Absence of any recognized quality management system is often every bit as powerful in proving negligent standard of care. My testimony that ISO 9001 is a basic driver's license required by any responsible company typically takes us to proving acceptable or negligent standard of care very quickly and convincingly. Of the myriad of companies that I've worked with, I'm blessed to have gained operational knowledge of many different industries, products, and processes. This background minimizes my required learning curve in most cases. While my testimony is typically focused on quality management, risk assessment, manufacturing processes, and organizational negligence, I've amassed a great deal of background working with other experts to provide a unified strategy to my client attorneys. The first question I'm typically asked in an attorney interview is, do you have experience in whatever the subject matter is of the case? My answer is no, but I can opine on whether the defendant exhibited an appropriate or negligent standard of care and provide objective evidence. Opposing counsel has yet to be able to convincingly impeach my written and oral testimony. I received my quality control engineer designation in 1969 from NASA and Ford Aerospace. It is now a recognized college degree field of studies. I'm a certified management consultant and a certified manager of quality and organizational excellence. Current day CMQOE is the highest level of certification available to any quality professional. My work has also given me the experiential background to publish 12 books on the topics of effective quality management, process controls, and standard of care. In 2010, I was commissioned by Lawyers and Judges Publishing to write Foreseeable Risk. It documents how my investigative techniques are applied to litigation. This book is also being used proactively by strategic thinkers in organizations that want to avoid civil litigation. By now, virtually all of you have had products liability case that involves a product or component manufactured offshore. While the retailer, distributor, or service provider is typically named in the lawsuit, there is little appetite these days to pursue an offshore manufacturer for several liability. Pursuing several liability is seldom cost-effective for plaintiffs because you're often unable to find where the product was manufactured. The various importers and brokers can obfuscate where the item came from because they often buy the same product from multiple sources. If the subject product in your case has no serial number or other form of traceability, it likely came from some big warehouse in Hong Kong and is of unknown origin. I've worked cases involving some of the largest retailers in the U.S., and they develop arguments that they are buying a part number from an importer and have no way of determining the quality standards of the OEM. To me, that dog don't hunt. The organization that introduces the product into the stream of commerce, in my opinion, has singular liability. Savvy defendants counsel, however, will do everything in their power to deflect blame to anyone else. My understanding is that most of these cases settle with some amount of money changing hands, while fault is never admitted or assigned. Moving manufacturing back to our shores will be a long and painful process. There are just too many moving parts in our supply chains. I'm currently working on a case where a discount distributor has a history of the subject device failing for a multitude of reasons. Even though the defendant produced warranty and failure reports in discovery, there is no way for a C&O expert to tie the subject product to a particular lot received by the distributor, nor to link the failure directly to any other reported defects or recalls. Utilizing any conventional approach to establishing duty of care, the best the plaintiff can hope for in this cesspool of conflicting evidence is usually a quick settlement without any admissions and without terms being revealed. I've had several cases where the defendant's behavior was so egregious that we were able to gain favorable outcome for the plaintiff just on the dramatic failure evidence. That strategy is risky, especially when FBP investigations are really your best bet. One of my benchmark cases involves a major and well-respected manufacturer of electrical outlets and other commercial and household electrical devices that was sold to a holding company. That company bought the manufacturing rights to virtually all of the hundreds of products that had been safely produced in the States for decades. The original brand name was well known, especially to electrical contractors. At first, the only evidence that there was any type of change in the products was the name of the holding company being substituted on the products. They were in the same bins that the original manufacturers were at the hardware stores and big retailers. In this case, a licensed electrical contractor correctly installed one of their dryer outlets in a home to power a window air conditioner. The outlet caught fire, destroyed the home, and killed the residents as they slept. The C&O experts traced the cause to resistive heating within the subject outlet. The fire experts constructed a model room and installed an exemplar outlet and air conditioner. In the photo, the exemplar caught fire within an hour of being connected to the air conditioner. Several of us visited chain retailers in different states. We found that some of the exemplar units exhibited the same defect found in the subject outlet. In this case, my reports, and those of the other experts of likely manufacturing defects, convinced the judge to allow us to do a facility inspection at the maquiladora in Mexico, where the subject outlet was manufactured. The holding company had literally picked up the equipment and remaining inventory of the dozens of product lines from the old company and placed them in the maquiladora. The same tools and assembly steps were in place, but none of the quality controls. During our visit, it was discovered that the assemblers had no idea of what they were making or how it was used. There was evidence that the same assembly tools were used, but the calibration stickers that showed the tools were acceptable had been worn off because of use. There was no evidence of any steps to maintain or calibrate the tooling. Observing the manufacturing process, there were several threaded components inside the outlets that were not tightened properly. Some were cross-threaded by the operators, causing the environment for resistive heating to occur. There were no inspections or tests performed prior to boxing the products and shipping them out. During our visit, we discovered another interesting issue litigators need to be aware of. A typical requirement for electrical products sold in America is to have an underwriter's label and listing number on the product. In this case, the listings were transferred to the new manufacturer in an unprofessional manner, consistent with how most products are factory-made offshore. The manufacturers are compelled to periodically call in UL inspectors to ensure that the listings are still followed. It just happened that the contracted UL inspector was there on one of the days we were. From the visitor log, I determined that the inspector was in plant for approximately 30 minutes when he allegedly verified compliance of the 1,200 product lines produced in the factory. The bottom line for litigators is to not overlook the fact that UL listings placed by offshore manufacturers are no longer evidence of adequate product safety. While offshoring is often an invitation to product liability that's difficult to prove, there are instances where organizations are tuned into foreseeable risk and create supplier partnerships with their offshore vendors. I helped Dell Computer write their supplier quality manual. It prescribes a year-long process of validating the capabilities and quality history for all suppliers, including their many in Europe and Asia. Knowledge that there are in fact organizations that are attempting to mitigate risk should be helpful in your legal strategy. As with other controls, ISO 9001 certification by these suppliers is always required. Each of you has developed a strategy that has obtained the verdicts or settlements most favorable to your clients. That basic strategy is likely employed at the beginning of each new case and has served you well. Occasionally, there's a scenario that rises causing you to look outside the box when seeking experts or in developing case strategies. Thinking outside the box is so last century. This training will encourage you to think outside the globe. Enlisting our help and employing forensic business pathology early in a case can save you exorbitant expert fees, frustrating discovery requests, and hours of research into evidence that may or may not get you to a compelling argument for your side. Attempting to establish a fact-based duty of care can range from being daunting and difficult to relying on the power of persuasion by experts. Unless there are compelling standards, statutes, or regulations that can be irrefutably established as being governing in your case, it's not uncommon to avoid attempting to find duty of care and move straight into opining about appropriate or negligent standard of care. Not only do we have robust methods for establishing duty of care, Proving appropriate or negligent standard of care is a much more desirable outcome than opining about it. So what is the forensic business pathology process? First, we establish incontrovertible duty of care. Next, we compare the facts of the case to the established duty of care. Then we build a legally compelling case for appropriate or negligent standard of care from fact-based evidence, not opinions. Over 40-plus cases, this methodology has had a 96% success rate, and 82% of our cases are settled out of court. There's likely no other strategy in products liability and organizational negligence tort that has this kind of repeatable track record. Another compelling statistic is that our retainer against billable hours typically produces a preliminary report that drives cases to early settlement. It's not unusual in a preliminary report that we overwhelm opposing counsel with empirical evidence rather than expert conjecture. At the end of this course, you will be offered a no-cost, no-obligation consultation on any cases or hypotheticals you may want to discuss one-on-one. So, what is quality? In the next slides, we will correlate a cogent definition of quality to products liability litigation. This will help you skillfully react to opposing counsel's attempt to create their own definition of quality. Quality is one of the most overused and misunderstood words in the English language. The term is used to describe everything from exceptional value as a positive attribute to unacceptable as in poor quality. Without a working knowledge of quality systems and establishing a clear benchmark for the word, this term can obfuscate the facts in products liability litigation. Separating the wheat from the chaff, the definition of quality that can be best argued is fitness for use. A defect-free product should be defined as fit for use, while the defective product is, by definition, unfit for use. There's seldom a need to attempt to define the nuances of quality. It's incumbent on litigators to establish this single definition as early in a case as is practical, making it more difficult for opposing counsel to muddy the waters with prejudicial arguments. Let's look at how we proactively develop the definition of quality in an FBP investigation. It's stated that the best defense is often a strong offense. In FBP investigations, it's usual for us to create a graphic of duty of care, standard of care, and other mitigating factors about the subject of the litigation. In this example, there would otherwise be little chance of establishing duty of care for a kitchen appliance. In this example, our quality systems and litigation training create sufficient experiential data to establish a robust duty of care. A toaster would be expected to fulfill the needs of the consumer that purchased it. Be safe, be reliable, meet any stated performance objectives, and meet implied requirements that a reasonable person would expect from a toaster. Expected standard of care by a reasonable person would include all the points defined in the table. It should brown a variety of bread products to the user's desired level of darkness. It should prevent electrocution. It should prevent asphyxiation. It should prevent personal injury. It should meet statutory and regulatory requirements. It should have a reasonable, useful product life. It should operate as described in the user's manual. and it should operate as a reasonable person would expect a bread toaster to work. There's an old adage in the quality profession that says if you can't measure it, it doesn't exist. The measurements in this table are included from experience working with electrical safety and fire experts and with our understandings from previous cases. Measurements can include repeatedly operates to stated and implied requirements. UL markings and labels are visible. The user is unable to access dangerous components without destructive invasion. The user is unable to contact lethal voltages or hot elements in customary use. There's no chance of electrical hazard around other appliances. There are effective warnings in the user's manual, and so forth. These cited requirements are mostly reasonable and prudent issues that the manufacturer should have included in their due diligence in placing the item into the stream of commerce. Rather than relegate such reasonable requirements to the whimsical interpretations of opposing counsel, FBP brings them to the forefront early in our testimony. Finally, the requirements for safety are levied in and by almost all jurisdictions in the United States. As stated earlier, they typically include a logo and listing number by Underwriters Labs, regardless of where they were manufactured. Safety testing labels are now global, and you are likely to see many of these on everything from toasters to computers. There are three key takeaways from our discussion of quality. First, it's defined as fitness for use and nothing else. If a case involves an electrical product, there are many approaches available to establishing duty of care and proving standard of care. Safety logos on products may or may not indicate appropriate or required testing. We use process flow charts in our investigative work. By representing this level of detail of information in producing an FBP expert report, the burden is now assigned to opposing counsel to refute rather than you to prove as expert testimony. By consistently following our investigative procedures, we produce compelling reports and testimony that is based on our experiences. We ensure you the most convincing testimony because our strategy is replicated from previous successful assignments. We also employ proven, highly detailed investigative techniques for our more complex cases. In our business process consulting work, we occasionally are compelled to use our organizational liability risk index to perform a deep dive into particularly elusive problems. Conventional quality root cause investigations unfortunately sometimes miss the mark in identifying complex issues of failures or process nonconformities leading to critical defects. In products liability investigation, it is too often the case that experts identify the reason for the failure, but not the root cause. In most cases, it's not warranted to take the costly steps necessary to uncover why the event occurred. In a recent case, however, there was an accident at a petrochemical plant that caused personal injuries. The allegations made by the plaintiff included obtuse accusations that several liability for the accident resided with a group of quality auditors who, quote, should have seen foreseeable risk and set up the scenario for the accident. This investigation took considerable research into the contractual requirements for the auditors, their actions in the case, and customary potential liability for such auditors. At the end of the investigation, the auditors were dismissed as defendants, and the deep dive was worth the time and expense. What about your experts? Do your experts use definable, repeatable, and proven investigative processes? Are you able to follow the logic of their reports and testimony, or just participate in verbal fisticuffs in depositions? Our process for generating rapid preliminary reports includes mining existing discovery and conducting online research, rather than submitting complex discovery requests. Search engines have become the go-to tool for finding information that we need to create our expert reports. Rather than burden our attorneys with convoluted requests for discovery and then waiting months for responses that are seldom useful, it's often more expedient and more productive to search the internet. While it's important not to quote any internet research as fact, there are often experiential and anecdotal gems to be mined that demonstrate repeated misinformation that supports our findings. Company websites are often created by sales and marketing people. Their content is often misleading and erroneous. We regularly use such information in bolstering arguments for negligent standard of care. Speaking of hidden gems, we often search the Wayback Machine to find website content that has been taken down or revised. In one case, we were told by a defendant that they did not have any published manufacturing or quality standards for their suppliers. We found their supplier handbook that was a current revision to the case timeline on the Wayback Machine. It had been removed from their website weeks after our preliminary report was published. We were able to find requirements in that document that were clearly not followed in the purchase of the subject consumer product purchased offshore. Our preliminary reports often drive cases to early settlement and are paid for within our retainer fees. Our preliminary reports are sometimes the only reports we need generate. While I am not privy to what happens when the attorney produces my report, it's often 6 months or more before I must ping them only to find out that the case settled. Sometimes I don't even get the dignity to send a final invoice. The preliminary research and report just consumed the retainer fee. This scenario is a direct result of being able to do internet research on applicable duty of care, how the organization represents itself to the world, and how much derogatory information is available in the public domain. The next 4 slides are included as experiential information that I've gathered over the years. They may appear to be self-evident, but they are worthy of consideration as powerful conventional wisdom. Again, they're not offered as professional arguments between sides, but memory joggers in creating your own strategies. Personal injury and death resulting from product-related incidents are predominantly the result of consumers using unsafe products incorrectly. Regardless, consumer products must and should be stupid-proof. Product defects are more often the result of processes out of control and companies abdicating their stewardship and accountability than from poor product design. Supply chain management tools do exist that can effectively control the safety, quality, and reliability of imported products, regardless of the country of origin. Product safety listings such as UL, CSA, and EU no longer give assurance of their intended degree of safety testing because unprincipled manufacturers have obfuscated the listing process to the point of impotence. While competition to sell through large chains and box stores may be a politically convenient rationale for compromising quality and safety in favor of lower prices, voracious business leaders do often make dissolute decisions to sell potentially dangerous products. One of my favorite losing arguments is, we have little control over the quality and safety of the products we import. Another is, it's not cost-effective for us to have consumers return defective products, meaning that we don't know if they're failing and why. Technology changes so quickly, we must sell products and services that are not well tested. Our products are safe. They're UL listed. All of these get 3 Pinocchios. More guaranteed losing arguments include, our product is not defective, the consumer used it improperly. The Consumer Product Safety Commission is the gatekeeper for preventing defective products from reaching the customer. We're developing new products based on renewable resources that will solve the current issues. We can't compete because of government regulations. I don't typically include testimonials, but I just received this one. In this case, I was not only the expert, but I was the principal investigator. According to the attorney, the plaintiff basically threw in the towel at the close of discovery. Again, he said, "Thanks for your work in this matter. Your expertise, investigation, and reports were the reason that we were able to resolve the case favorably for our client." The following case studies are examples of cases for which we were retained as experts. The forensic investigation is performed by experts in the failed product. The FBP investigation is our concurrent and collaborative investigation into the defendant company. Think outside the globe is our suggested strategy for innovative litigators. The investigators traced the cause of a house fire that killed several people to a portable space heater. Even though space heaters are designed to heat a specified amount of space to room temperature, their internal temperatures are at or just below ignition temperatures of fabrics and other household items. There are mandated safety devices to turn the heater off if it is tipped over, but there's no safety device to ensure common sense use by the consumer. The causes and origins forensic investigators discovered that the plastic used for the outer housing was not the required grade of plastic that would contain sparks and potential ignition of the heater. Even though the product manufactured in Asia had a UL safety listing, the manufacturer was able to use inferior plastic without challenge by the Asian testing agency. Evidence from my investigation discovered that the space heater had the brand name of an American company. Attempting to trace the actual location it was manufactured, however, was obfuscated by a quagmire of holding companies, importers, and multiple factories which made similar products. The FBP investigation was unable to locate the UL testing records or any documentation of the defective heater. If there were any, the records had been successfully hidden in the long chain of custody. Organizations that choose to outsource the entire manufacture of their products sometimes ignore the potential risk of lack of first-hand control. Some intentionally build in plausible deniability of how the product was manufactured. Others are just naive in assuming that their products will be assembled and tested to the same standards as they are in the U.S. While the victims may have placed the heater in close proximity to a basket of laundry, they never imagined that there would be sparking that would occur to catch fire and ignite the laundry. We regularly argue that the manufacturer has sole liability for foreseeable risk, including how customers might use their product badly. Unfortunately, more current versions of this American branded heater are still for sale in the retail market. We can offer no viable strategies in these cases where large retailers intentionally create smokescreen barriers to them being proven liable. In such cases, it's sometimes wise to adopt the line from the movie War Games that states that the only solution is not to play the game. Hospital personnel were unable to revive a young girl who was administered an incorrect intravenous medication. The youngster was admitted with breathing problems, and an IV was ordered with a medicine that was designed to relieve her congestion. The hospital pharmacy had dispensed a medication that had a very similar name, but was formulated to induce coma in a seriously injured adult patient. The plaintiff's family filed actions against the hospital and against the manufacturer of the automated dispensing machine that was used to fill the prescription. It was alleged that both were negligent in the wrong drug being administered to the child. The hospital obviously had the strict liability due to human error, but the machine manufacturer denied any liability. My FBP investigation of the manufacturer of the automated dispensing machine revealed that the company had been aware that there were drugs named so similarly that there was a real possibility of dispensing the wrong drug due to operator error. They had also been investigating methods to ensure that the possibility of confusing two drugs was nearly impossible. My conclusion was that the manufacturer exhibited an inappropriate standard of care in not ensuring that their machine could have been complicit in this death. Due to the critical nature of the machine, the duty of care of the manufacturer was to foresee the possibility of similarly named drugs being confused. It's common now on drug labels to describe the contents such as an oval red capsule. In this case, such a description would have avoided the incident because one was a pill and the other was an IV bag. The greater the foreseeable risk is to life and personal injury, the more critical it is to have risk avoidance built into all processes and training. During recent hospital visits, I have witnessed prescription medications now being administered in individually sealed packets. Perhaps the benchmark for duty of care is rising. The manufacturer's position that confusing drug names was nearly impossible doesn't work for me as a standard of care in pharma. Two avid female golfers were playing a very hilly golf course. They had rented a golf cart from the clubhouse and were enjoying their play. Traversing a very hilly path, the passenger was thrown from the cart and sustained major damage to her spine and hips. Detailed investigation of golf carts revealed some disturbing facts. The side handles are very small and recessed so that golfers can slide in and out of the seat. There are no safety belts. There are no handles on the dash or on the canopy structure. While they do have a controlled maximum of speed, it does not take into consideration steep terrain. What limited safety warnings were provided were underneath the place where the scorecards were retained. In my investigation, I found that the passenger was only 5 feet tall. There was absolutely nothing she could hold on to as they traversed the hilly course. In deposition, the manufacturer represented that they had to design golf carts for large and tall people to easily slide in and out. They claimed that golfers would not wear seatbelts, and they saw no need for any handles or grips. The most shocking testimony was that the company had a long history of defending lawsuits from individuals who were injured using their product. In fact, this company had a line item in their budget to cover lawsuits. It's not uncommon for organizations to build into their budgets the cost of defending lawsuits. Some have an operational philosophy that includes that they will routinely injure users in the normal course of their business. FBP investigations reveal these fatal flaws and create empirical evidence for inappropriate standard of care. It's commonly accepted that products will always have a certain failure rate that is acceptable and unavoidable. Regardless of that myth, for plaintiffs, there are decades of industry and quality standards that can be successfully argued as the basis for negligence. For defendants, immediate discovery of any legitimate issues of inappropriate standard of care will lead to most favorable outcomes. A family purchased an artificial Christmas tree from a major retailer. The tree was pre-lit, meaning that it had festive lights pre-wired into the trunk and branches. In the plaintiff's home, the tree was left on overnight. Parts of the wiring that were poorly assembled caused overheating and a resulting fire. 2 youngsters perished in the fire. The electrical fire experts traced the origin to electrical connections that did not completely capture the wire inside the lamp sockets. The intermittent connection caused contacts to get hot until they finally reached combustion temperature. As we've discussed earlier, all electrical appliances sold in the United States must undergo safety testing prior to being offered for sale. For decades, Underwriters Labs has been the most trusted name in product safety testing. Each product must contain a UL listing number that can be used to trace the product back to its initial safety testing. This testing must be done on an ongoing basis and every time a manufacturer changes a critical process or component. As previously discussed, while these trees had UL listing numbers, they may or may not have been subject to the rigorous scrutiny of UL that it is famous for because they use contract agencies outside the U.S. The product went through so many distribution and warehouse facilities, it was virtually impossible to trace it back to the certifying agency in China. In this case, the large retailer was so well positioned with intermediate organizations that their attorneys successfully had them dismissed from the case. The family of the plaintiffs were left with attempting to find libelous action within several overseas entities, making it impractical to pursue litigation. My advice to attorneys who bring suit against major retailers and distributors is that our empirical arguments about quality and safety standards being a benchmark of duty of care is wasted when the only strategy of the defendant is to drag the lawsuit out in time and complexity until the plaintiff runs out of resources or, in some case, dies waiting settlement. A youngster was electrocuted while attempting to charge the battery on his go-kart. The battery charger was very old and in poor repair. The boy was barefoot, and the grassy field around the go-kart was saturated from a recent rainstorm. The extension cord the boy used to reach the nearest outlet, had the ground pin cut off because the older home only had two-prong non-polarized receptacles. The forensic investigators for the defense developed a body of evidence that they were certain would prove total negligence by the plaintiff and his family that led to his death. The forensic experts for the plaintiffs discovered a frayed wire inside the battery charger that, with time and improper manufacturing techniques, caused the metal case and handle of the battery charger to be alive with 120-volt house current, rather than it being grounded or neutral. My investigation of the manufacturing techniques used in the old battery charger were substandard, and there were many opportunities for the wires to become abraded and contact other metal objects inside the unit. Further investigation of the current version of that model battery charger had a plastic coating on the handle, and the wiring was bundled and immobilized for moving or abrading during normal use. This would have prevented the perfect storm. Regardless of the overt negligent use of this product, the case was settled in favor of the plaintiff because the manufacturer was proven to have failed in their standard of care to manufacture a product that was innately safe under reasonably foreseeable scenarios of misuse by the consumer. We even worked with the consumer advocates in this case to add stupid proofing to their lexicon to anticipate every plausible misuse of products by a consumer. Over my career, as each of these cases was worked and settled, I had two professional epiphanies. The first was that the manufacturing processes and defects evidenced in these cases was totally foreseeable and preventable. When lawyers and judges publishing approached me about writing foreseeable risk, I not only had sufficient data to make the case for foreseeable risk, but I also had developed a body of knowledge for enlightened business leaders to learn from these case studies that risk avoidance must be part of their strategic business plan. The second awakening was that, as a decades-long quality professional, the very foundation of my chosen profession was flawed. The focus of our professional training and operational work was minimizing defects, not avoiding them. Until I was part of litigation where people had died as the result of defective products, I did not realize that reducing process variability and driving defects down to an acceptable level was not acceptable at all. I've since focused my consulting and training work on removing process variability and preventing defects from reaching customers. I'm currently working with 3 internationally recognized quality training organizations to create coursework that will certify quality professionals as forensic business pathologists whose mission is to derive process excellence and avoid foreseeable risk. You will probably agree that this CLE training course is unlike any you have attended in the past. It exists to present you with the novel and proven techniques for improving your effectiveness as a litigator, primarily in products liability and organizational negligence. The author is available for private consultations and to answer questions of how these techniques can save you time, expense, and drive litigation to more rapid conclusions.